Hey everyone, it's Dr. Stephen Kosterman with Kosterman Chiropractic Center in Cary, and we're talking in this video series about migraines. And in this video in particular, we're talking about why would we take an x-ray potentially on someone that comes in with a complaint of ongoing migraine headaches. Well, I will show you very simply in an example here with the patient that we have that comes in suffering with migraine headaches. It's very common that we see this. So first thing I want to do is show you what normal anatomy looks like. So when we take a picture of someone or your spine from the side, it should have a curve in it, roughly 40 degrees. I always say it looks like a banana. The curve's in there for a reason, to absorb force. All the muscles, tissues, ligaments, nerve discs, and tendons and the vertebrae are all comfortable when you have that curve in there. And there's not a lot of extra tension on your body, spine, or nervous system. So this is normal. So this is the atlas, top bone vertebrae. 2, 3, 4, 5, 6, 7 bones in the neck. You can see how it has this curve. That's designed to be in there, right? So in this particular position, all the muscles that overlay this are at ease. They're not stressed and tensed. The nerves are not being stretched, literally, and tense and compressed. The vertebrae are obviously not aggravated. The disc spaces are nice and open and even, and there's plenty of room for the nerve back there. This picture is very common of what we see with someone that comes in with headaches. So as you can see, this patient is missing this beautiful curve. So their spine, C1, 2, 3, 4, 5, 6, 7, looks more straight. It's almost kind of bending forward. Imagine what that's doing to the nerves. It's stretching and straining all those muscles and those tissues, and the ligaments and the disc are being compressed. No wonder they have a headache. So you lose that curve. It pushes forward. My measurements of roughly 41 millimeters. So instead of your head putting about 8 to 11 pounds of pressure on your spine, it's putting about 28 to 30 pounds of pressure on your spine. The nerves, the cord, the disc, the muscles are being stretched. Everything's pushing forward. So the muscles are having to hold your head from falling forward. And then as a result, you start to compress a disc space. So instead of this C5-6 space being nice and open, it's being compressed. So is this part of the problem? I would say yes. So what should we do? We should address this component too. Now this patient may have a dietary component. We'll address that as well if there's a muscle tension component. But this certainly gives us some information as to tailor their plan and get them doing some corrective things at home to lay on a specific neck orthotic that we have to start to put that curve back in there. Because what does age and gravity do? It's going to keep pulling you forward. This is how individuals get to this slouching posture when they're 60, 70, 80 years old. It's okay and common to be, well, I guess it's not as common, but it's normal to age gracefully with good posture here, but not if this starts in your 30s. So when you come into our office for care, we're going to do everything we can to find out exactly what's driving your migraine headaches. And if one of those tools is a digital x-ray, we'll get that photo and see what's going on underneath so we can tailor your care. Because at the end of the day, you want to get rid of these headaches. You want to enjoy life, enjoy your kids, focus at work, be creative, because life's short. We want you to enjoy it to the fullest. If you're suffering from migraine headaches and you need some help, we'd be honored to. Thanks so much for listening, and we look forward to seeing you in the next video.